One of the most difficult moments was when I felt prejudiced, because this disease brings along prejudice. They just want to know who's infected and who is not, but they don't come by to ask you if you had lunch, if you're alright.
With less than 16,000 inhabitants and located on the banks of Jari River, 303 kilometers away from the capital, Macapá, Vitória do Jari is a municipality responsible for a large part of the medical care of the river-dweller population and communities located along the river, which are located up to 6 hours into the river, such is the case of Jarilândia and its surrounding villages, that totalize over 1,300 inhabitants and almost 300 households. For this to happen, the municipal health team travels by boat for many kilometers away from the comfort of their homes. But they have a great mission, bringing health and hope to whoever they meet, no matter how far they are. Night is already falling when they come to the community, and just a few minutes remain until electricity is cut off. In this location, the supply of electric energy happens from 5 p.m. until midnight. Most of the crew rests now, as they need to wake up well for the day of activities.
Working with public health system, not facing a pandemic, is already challenging. But working with the same system during pandemic times is even more challenging, especially when it comes to areas far from the capital, far from the municipal headquarters. So, by thinking of it with a more general perspective, in a more compassionate and sensitive approach, we decided to improve our services for these communities.
COVID assistance planning was first held with the training of the health professional team for the municipality as well as for the communities in general. That's when the health surveillance team takes action, monitoring the symptoms to see if that patient is taking the medication correctly, followed by usage instructions. And for us, this is gratifying and important to emphasize that the mortality index is 0 in the river-dweller communities. Their access to the urban area as well as medical care and a follow-up with experts is difficult.
Dois acessos vão pegar a assinatura do paciente e ver a comprovação. Tá aqui no nome na lista.
In our state, the increase of death index happened too quickly, as well as the number of confirmed cases, which led us to plan a strategy to protect the group that is most affected by the coronavirus, which are the elderly, pregnant women, and hypertensive people. So, by thinking of this risk group, the health team left the municipal headquarters on boat. Because we live in a riverside region, very different from the capital where we have the drive-through. So we went to see those families' houses. In a preventive approach, aiming for this risk group, we delivered healthy food, masks, hygiene and cleaning materials, vaccines, COVID-19 rapid tests, etc. We thought about not only treating the disease, but also preventing it by improving the patient's immune system, so that if suddenly they get affected by the virus, the likelihood of supporting it would be higher.
I got sick on the 7th, on May 7th. I woke up feeling feverish. Still went to work though. Then on Friday, I couldn't handle it anymore. Then I felt sick, fever, headache, except for a sore throat, and then intense body pain from that day on. By Saturday and Sunday, my 2 kids came down with the symptoms. Actually, nearly the whole family got sick, at least the ones who were here. One of the most difficult moments was when I felt prejudiced, because this disease brings along prejudice. Some people do not understand what other people go through, and instead of helping, they judge you. They just want to know who's infected and who is not, but they don't come by to ask you if you had lunch, if you're alright.
Aí fica aquela dúvida.
They wonder if your house is infected, if they can get close to it. Those were the hardest moments. Sometimes TV news shows several people died, it kills many people, but we live in a village, in the countryside, so for us, our God comes first, so that we become hopeful. Because if our God comes first, we'll overcome it, right? I felt very welcome because they are always ready to help people in need. At no time we were left unsupported. You know, they always checked us up. If we were following their instructions correctly, we all took our meds.
On Sunday, I had fever again, a very high fever. And then on Monday, I told my wife I was gonna ask for Jarilandia's teen support, because I was told not to go there. I was supposed to report instead if someone was sick, because the pandemic restriction was already enforced, right? By the afternoon they arrived. They treated me very well. They came here, I was aided. They supported me and my family. And then I started getting better. My family got better quicker. I've been through worse. Because I'm older, right? I feel very happy. Happy to live here. Because in fact, we live surrounded by this beautiful landscape here. Especially being well cared for when it comes to health. It's been a long time. I've lived here for 27 years. And with all the people around here, I mean, village neighbors, they all say they felt very welcome. I got my radio system here, and I can talk to other people, to my friends, people who I work with.
Being a nurse and dealing with coronavirus, which is an invisible enemy yet unknown worldwide, people put blood, sweat, and tears. Considering we're in the countryside, we are not able to take these patients to the healthcare facility if their clinical state is worsened, either taking them easily to the city or offering a better resource to treat them. Here is a totally different scenario, because we have to go to this patient's home, check them up almost every day. Make sure they're taking their medication according to what they were told, according to our protocol, monitoring daily or even weekly, so that it don't get worse throughout the treatment period.
What people needed most, in this moment our country is going through, was the national health system. Even the ones who have health insurance, the ones who can afford private hospital treatments. Every single person, with no exceptions, needed the national health system. And that's such a big responsibility. For sure, we'll have better days, hoping to overcome this pandemic of the new coronavirus together.